In this video, we're going to discuss the understanding of the high frequency unit. Previous video, we did understanding galvanic, and that's a super important one. This one is equally important because the high frequency unit is something that the client could actually use at home if they were so inclined. Most of them, in my experience, won't do it because they're apprehensive and afraid of it because they don't understand it. And what you don't understand, you don't really learn about, because if I'm not understanding it and it's electricity, I'm truly afraid of it and I want to set it off to the side. When you, the technician, are apprehensive and or afraid of the unit, that's going to translate into your client, and they're going to go, oh, maybe we don't want that. A client who's never had a high frequency treatment needs to be introduced to the unit just like you would if you were giving a child a haircut. When you have a small child and you take him to the barber and they turn on those clippers and the kid hears coming at him, they scream, cry, and they have a terror attack. Whereas if the barber would have taken the clippers and put them in front of the child and told him to hold them before he turned them on, and then turned him on and said, okay, this is what you're going to feel. This is how it's going to do. It doesn't hurt. It feels kind of funny. It tickles, doesn't it? And you put these thoughts into the child's mind, then when you go to cut their hair, they're fine. And that same philosophy is through to adults. I need to explain to my client how the unit works. Yes, it's electricity. And yes, it's going to give you that prickly, tingly feeling, like when you hit your crazy bone and that shoots up your arm. It doesn't really hurt. It's just electricity going through your body naturally. So when I explain this to her and I show her the electrode and I turn the machine on, I touch it, then I tell my client, now you touch it. And when she touches it and I'm touching it, the electricity, most of the electricity is going to me. Okay, so when she touches it, she's not getting very much. Okay, then I'm going to remove my fingers, and it's just her, and I'm going to say, this is the sensation. This is the sound it makes. This is the feeling that you're going to feel. It doesn't hurt, and the benefits are amazing. And if you want to go into the benefits with her, you can. It depends on your client. Some really want to know, some don't care. Some wouldn't understand what you were telling them if you were telling them. But now back to you and understanding the electrical current. The sinusoidal current is a mechanical current that exercises facial skeletal muscles as well as smooth internal muscles like the liver and the kidneys. So when a client has a paralysis from either an injury or a stroke, then the doctor is going to send them to the physical therapy doctor, who's going to prescribe to them the treatments that they need to exercise facial muscles, arm muscles. If it's my left side that's run amok, then that's the side that's going to get the treatment. But it does both internal and external muscles. As such, as an esthetician, you're not allowed to use it because we're not licensed for that. However, the high frequency is a form of this current. Like ice and snow and steam is a form of water, they all have the same chemical formula, H2O. It's just the form has changed. The high frequency unit oscillates so rapidly that it produces heat, okay? And it's going so quickly that there's no muscular internal contractions and very minimal on the external. So on the face, the high frequency unit stimulates muscle. Okay, it stimulates blood flow. It brings blood and lymph up to the epidermis where we so desperately need it. As an anti-aging tool, you can't beat it. And that's because at the base of the electrodes, this is the base, okay, there's either an argon gas or a neon gas. And when it's plugged into the unit and turned on, the electrical energy that comes down the tube is either going to be violet if it's argon, or it's going to be orange if it's neon. So you have your choice of which gas to use for the service that you want to give. Now, based on that, regardless of the gas, it can be either neon or argon. They both stimulate blood and lymph. They both stimulate muscles. Okay? They both produce a negative charge. Ozone gas is negatively charged. So if I have a negatively charged product on my skin, when I apply the electrode, the negative is going to push the negative in. And so now you're going, well, I don't know if my product's positive or negative. Okay, so if your product is positive, like a moisturizer, and you're using the unit because this is negative and the moisturizer is positive, the moisturizer is going to stick to the electrode and coat it, and you're going, it's not going into the skin. Well, it's positive. If it's negative, it pushes it away. So all you have to do is maybe put the product on the back of your hand and test it. I mean, you don't want to put a moisturizer on my face and tell me you're going to push it into my skin when you can't. Okay, as soon as that happens, you have to use a positive energy, and that would come from the galvanic positive and or your skin scrubber. Skin scrubbers have both negative and positive, and they're not going to neutralize the IUD like the galvanic would, because it's only topical and it's negative and or it's positive, whichever button you've pushed, and it's not going through the whole body. It's only working on the area where that unit is actually touching the skin. So it stays very epidermal. It's not even going to push it into the dermis. It's just going to push it into the epidermis. Okay, so your skin scrubber is a great alternative for someone who's contraindicated to the galvanic because of their method of birth control. Now, when I get treatment specific, that's when I need to use the correct gas. That's what I need to know. Okay, so if I'm using the argon gas, okay, it reduces oil production in the skin. Remember that blue, calms, soothes, sedates, etc. And it slows down the oil production. So it's basically used on oily skin, and it, I forgot what I was going to say. How do you like that? Okay, let me take a look here. This is not good. Okay. Of course, one of the most important things, it kills P. acne. Now, acne is caused by the Propionibacterium, and the Propionibacterium thrive on the oil in the oil gland. So twofold, it's going to help reduce the oil production, okay, and it's going to kill the P. acne germ. And based on that, if I'm working on an oily, normal to oily skinned client or a client with acne, then I'm going to choose to use the argon gas. The neon, on the flip side, stimulates oil production and increases oil production to the skin, and it also, because of the color, stimulates the fibroblast cells to produce collagen. So as an anti-aging tool, this is priceless. The neon is priceless. It's going to stimulate the facial muscles to maintain their tone, their muscle tone, and it's going to stimulate the fibroblast cells to produce collagen, which keeps the skin firm and elastin. So as an anti-aging tool, this is priceless. Okay, so now that hopefully you understand where it came from, it comes from the sinusoidal current, okay, which exercises muscles. So I'm getting a mini workout as well. It's also worth, a 5-minute treatment is worth a half-hour sleep. Remember, your body runs on electrical current. That's why the pacemaker regulates the heartbeat. It produces positive and negative energy, and it regulates the heart rate. So when you use the high frequency unit, a half-hour sleep is like a power nap. And everybody knows that a power nap, you feel really good afterward. So when your client gets up off the couch, after you've done the lymph drainage, acupressure lymph drainage massage, and she's had a 5-minute treatment with the high frequency, she's going to feel so good. She's going to have energy. And she's going to go, wow, I feel really good. And when a client gets up off the couch, if they don't feel different, they're not coming back. I don't need you to wash my face. I can cleanse my skin myself. You know, I don't need you to use a scrub. I can buy a scrub at the 99-cent store and give myself a facial scrub. What I need is your knowledge. And if you haven't done your homework and you don't understand the tools that you're using and using them to their optimum benefit, okay, then why do I need you? Anything you can buy on Amazon, I can buy too. I can do it myself. So the only thing I can't buy on Amazon is knowledge. And the person-to-person contact, when you're talking to me and I'm talking to you and we're interacting, we get that connection. Women make friends by communication. And if there's no communication, then there's no connection, and then they have a tendency to not come back either. And the whole thing about it is client retention. We need our customers. So now that we know where the high frequency originates and how it works, we'll look at the electrodes that are available to you. This one is called the mushroom, and it's used for, you know, basically surface on the face and wherever you want to use it. They call this the tongue, and I'm put it here, maybe you can see it better. I call it a spoon, because to me it kind of looks like a spoon, but it's for getting closer into the eye area and around the nose. But I personally use this one all the time, and I just use it on my face like this. I use the whole arm and just turn it, and I get my whole cheek. I come across my mouth this way, and then I come up this side, and then I go across my forehead and around my nose. So it doesn't matter which one you choose to use. This little guy right here is for a target. If I lean back, maybe you can see it better against my dark shirt, but it's targeted. Now, technically, you shouldn't spark, but let's just say you have this humongous zit right here, and you just kind of aim this at it and you want to touch it just to that spot. So for acneic skin, you can target individual breakout. It's really excellent for cystic acne, which is totally under the surface of the skin. It's not going to come up for a long time. Then this is going to kill the bacteria which is in it, maybe. Okay, now having said that, P. acne is anaerobic. It dies in an oxygenated environment. Staphylococci, on the other hand, is not that way, and oxygen actually exacerbates the staphylococci, except for one strain, which is the one that's found in pimples. It can be negative. So as a skincare therapist, you don't know which bacterium is actually causing the pus and the pimples. 90% of the time it's going to be P. acne. 90% of the time this is going to be perfect. The other 10% of the time it's going to be the one that is exacerbated by oxygen. And the client needs to be told that too. If you're working on acneic skin and you're giving treatment and she thinks she's going to wake up in the morning with a healthier skin, and she wakes up and she's full blown broke out, she's going to be on that phone. Oh my God, I can't believe it. My skin's all broken out. What did you do to me? Okay, so you need to explain to them when it's an acne treatment that even though you're using the blue, the argon gas, which kills and destroys bacteria, if they're having the strain of staphylococci that actually grows in an oxygenated environment, they may experience breakout. Please let me know. Come back and clean it and let me use some other method to destroy that bacteria, which would be the blue light. The blue LED light will destroy the bacteria too. And you can even, depending on how if you have a series of treatments, and I've paid $1,000 for a series of maybe 5 or 6 treatments, give me the handheld LED light, as a gift with purchase. They cost you like $35, $40 on Amazon. You just took $1,000 from me. Okay? And so you can afford to give it to me, and you can tell her in the morning if you see breakout, hit it with that blue light. And once she understands that this is a possibility, she's not going to be mad at you. Okay? Because it's not going to happen that often, but it does happen. This electrode also can get right in here. Okay, and I like this one for if I want to work in here and around the eye area. So you have the tools. This one, this little guy here, is for what we call general. And when your client, depending on body weight, by the way, it takes a while for this high frequency current to get through the system. Okay, and the heavier the client, the longer it takes for it to be beneficial for you to get that half-hour worth of rest. So while you're setting up, you can have the client hold the electrode like this. And her body's absorbing the electricity. She's getting the benefit. So she's going to have even maybe more than a 5-minute treatment. But she's holding this while you're... Now, notice I have my ring on and this is touching it. That's a no-no. It's going to hurt. I'm going to get burned. Okay, so if they have jewelry, make sure that you have them hold it in the other hand, or take off their jewelry so that there's no contact with anything metal, because this creates heat. It's going to totally burn the client, and we definitely don't need that. This is the rake. This is for hair loss. So you shampoo the hair and you bring in, you do your treatment, okay, all over the scalp. The hair needs to be clean and slightly damp, because if there's any lotions or tonics that could cause an ignition and a fire, a sparking might occur, and that's not a good thing. Now, male pattern baldness starts in the front and goes to the back. This is of absolutely no benefit. The hair follicle is dead. But when you look at the crown of a man and you see hair loss from back here, that's stress. He's losing his hair in the crown area from stress. And if you look, you see fuzz. Okay? Now, if I'm working in this fuzzy area, the hair follicle is just dormant. It's not dead. And this, because it stimulates blood and lymph flow, is going to bring nutrition up to the hair follicle, and you will stimulate hair growth. Takes approximately 2 months for them to actually see the benefit. And it can be done every day. So, if a client wants to give her husband a nice gift, this is part of it. All right? But you just have to make sure that they understand how to use it safely. You can. These machines for facials are very mild. Normally with the high frequency, you make contact, then you remove your contact. When I need to move it, I touch it again and take it off. And then I remove my hand, and then I touch it again, and I work my way across the scalp. These units are so mild, they don't have that much power, that even when I'm doing my own face, I just touch it, But you still need to be very careful. I use my unit on high, but when you're first starting, you have to use it very low because they may not tolerate as much electricity. So you always want to start less, and then you work up to getting more and more and more. This one is called the horseshoe, and it's for the neck. And this one needs to be neon gas, okay? Because it's old people who start losing the elastin and the collagen in the neck area. Now, a contraindication for this is a few years ago, I felt I had a complete shoulder replacement. So I have metal here. So now I can no longer use this because the electricity goes straight to that shoulder, and the metal that's in the replacement, and where it doesn't hurt that day, the next morning when I wake up, my shoulder would ache, and I'm going, gosh, what did I do? And then finally, not paying attention to how I teach. I would practice what you preach. Yeah, maybe. But because I really didn't think about it, I it took me a while to figure out, oh my God, it's a high frequency unit. Because I would come down my neck and my chest. And I was like going, I can't do that anymore. So if they have metal implants, especially dental, if they have dental implants and you're going over the high frequency, their jaws may hurt in the morning, the next day. Now they're not going to hook it up to you, what you did, but you don't want to cause them any discomfort. So if there's dental implants, you want to be very careful that you maybe do it only for a few seconds in this area. I can do more here and around the eyes, and that's fine. But and if I have metal screws and pins in my leg, and it doesn't bother that at all. It's too far away, so I don't have any issues with that. So there's some things now that you need to know. Number one is the source of the unit is sinusoidal muscular contractions, okay? But it oscillates so rapidly that it produces heat, and the constrictions to the muscle are minuscule. But boy, they're there. I don't have wrinkles, okay? I have bags, but I don't have wrinkles. And at my age, I should look like a raisin. All right, so it happens to be that because I've taught aesthetics for so long, and during a classroom demo, I go, look, see, it doesn't hurt or I wouldn't do it, and I'd run it all over my face. So I was getting treatments, since I was like 25 years old. And it maintains if I'm trying to rejuvenate muscular structure. And it will, because the body's an amazing machine. If you start eating correctly and going to the gym and doing what you're supposed to do, you will lose weight, your muscles will tone, and you can get that six-pack, okay? It's going to take a year, maybe two, but you're going to get it. So we're so used to instantaneous gratification that when you tell a client, this stimulates and it does this and this, she expects to wake up in the morning with a new face. We stand in front of the mic, we may even say, hurry up. And it's like, relax, chill, unwind yourself. Anytime you're doing facial rejuvenation, always remind the client it's like going to the gym. You're not going to see the benefit tomorrow. And consistency is the key. If I only go to the gym once a month, I'm not going to see a benefit. All I'm going to do is have pain. If the client comes to you once a month, she isn't going to see any of these benefits that we're talking about. It's all going to be, just in the moment. If I go to the gym once a week, I'm going to see benefit, but it's going to take a while. If I go to the gym 3 times a week consistently, I see complete improvement within 2 or 3 months. I have noticed weight loss. I've noticed a whole improvement. I'm all excited, and that keeps me wanting to go. Now, clients can't afford to come to you 3 times a week. That's why they need handhelds, and that's why you need to educate them on how to take care of it. Then they come to you for the main treatments and the masks and the packs and the such like that. So once I have chosen my electrode, what I'm going to use, and the type of gas I'm going to use, and the treatment, I have my dry skin, okay? I have my oily skin. I have combination. This is great for combination skin. I use the neon in the dry area, and I use the argon in the oily T-zone. And of course, my product would change. I'm not going to use the same product in the oily area that I would use in the dry area. So now, once again, my product chemistry is key. You have to know, and of course, just starting out, and if this is a first thought to you, we're not chemists. We don't speak chemistry. When you look at the bath and back of the ingredients, you see dimethyl, and you go, I don't know what that is. Well, neither does your client. But you know what? It's as close as your cell phone. Siri knows. All you have to do is ask her. She gave you the information. When I was your age, we had to go to the library and get a book that was possibly out of date. But today, your technology is so up that all you have to, everything's as near as your phone. Everything you need is in your phone. There's no excuse when you're reading the ingredients for you not to know what this product is, what it's for, and where did it come from. Because of allergies. Medications and allergies have interaction. So basically, we've covered the benefits of the high frequency, okay? And we've covered basic how to choose what to use to get the product into the skin. So now let's take a look at what I do in the morning. Okay, I get up, I wash my face, rinse it off, and then I put on the Epicurean Aloe Gel because the high frequency unit needs something slick on the face. It needs to be wet, and the oxygenated aloe from Epicurean is amazingly wonderful. So then I take my high frequency unit and I go all over my face. That's all done in the bathroom. Then I come into my office in here, and this is where I have a vitamin C serum that I occasionally use from Dermalogica, but I make my own hyaluronic acid. So I put my hyaluronic acid on my face, and then, because that's negatively charged, I put my regular moisturizer on. I use Eucerin, put that over my face, and then I use the red LED light, which is galvanic based, and I rub it and I exercise my facial muscles with it. And that's a whole nother video. But it's a very simple routine. Because I'm ADHD, I don't have time to do step 1, 2, 3, 4, 5, 6. And a lot of clients don't have that time frame because they have children. Okay? And every mother knows that as soon as you go in the bathroom, all your kids want you. Don't ever close the bathroom door because immediately it's, Mom, Mom. Okay? There's something about the hinges in the bathroom door that wreak havoc in a household. So if you have children that you have to get ready for school, and you're trying to get ready for work, your routine has to be something you can do in 5 minutes or less. And that routine is you cleanse, you put do a minute treatment with the high frequency, come in and put your moisturizer on and split, and then you do your makeup. And then you're good to go. When I was young and had kids that I had to get to school, I would put my makeup on in the car on the way to work. And I would take surface streets. And so I'd put my foundation on at one red light. The next red light, I'd get an eyebrow. The next red light, I'd get the other eyebrow. The next red light, I'd get my upper lip. The next red light, maybe the lower lip and some blush. And if by chance I got stopped by a train, I got my whole face on. So rather than stress about a routine, give your clients some ideas on how to work skincare into the routine they have. And if it means applying it in the car at a red light, that's fine. At least it's getting on. So hopefully, if you have any questions, I don't know how to get a hold of you or you to get a hold of me. I have a handout that is for the college, which is on their Canvas shell. I don't know how to get it to you, but I just want you to know that your high frequency unit, if it's used consistently, is going to bring you a lot of client return, because building a clientele in our industry is kind of tough. So having your treatments be effective is key. So if you're using the right products and the right electrical tools, that client is going to see an enormous improvement in their skin. And then you give them the how to do it at home. And if you're worried about giving them electricity to use and they're afraid of it, you can teach them how to do manual. And the eye area is the first to go. So if you just take these two fingers where the hair of the eyebrow begins and the arch is, and you push it up onto your frontal bone, and you apply pressure, and you count to 3, and then you release the pressure, and now the ring finger goes at the arch, and the other finger goes at the end of the brow, and you apply pressure, and you release, and then you walk your way under the eye, and then you apply pressure, and you release it. Just that one time I did that, I can feel the orbicularis oculi muscle working. And so if you do that, you're going to eradicate the wrinkles and the fine lines that come around the eyes. And your client can do that when she applies her moisturizer. Press, release, walk across, press, release. And it's amazing what you can do. To work this muscle here, you can put your fingers in your mouth. Everybody knows how to do fish face? Okay, so you're gonna do that while you're pulling out like this. Okay, and this exercises and creates a hollow in here and helps prevent the sagging. Okay, you can see a little bit of sag, but not much for my age. You see a lot of women who have this pouch here, and by doing that, they can exercise it and retone that muscle. It takes a minute, but once again, it's consistent. So it's important that you educate yourself so that as you do your treatments, your client has complete benefit.